But when it comes to the topics at last night's debate, another hot one was Medicare for All. Take a listen to what former Mayor Pete Buttigieg had to say about that.
When it comes to health care, you can do it in two moves. Of course, my plan costs $1.5 trillion over a decade. No small sum, but not the 20, 30, 40 that we're hearing about from the others. All I got to do is two things. Both of them are common sense. Allow Medicare to negotiate prescription drug prices and roll back the Trump corporate tax cuts that went to corporations and the wealthy that didn't even need it.
All right, there you go. Joining us now to discuss is Yahoo Finance's Anjalee Khemlani. And Anjalee, I mean, it's been something that Mayor Pete's been trying to distance himself on, Medicare for all who want it. But it's a very interesting topic and very different than what we've heard out of Bernie Sanders and Elizabeth Warren.
Absolutely. And it all comes down to the economics of it. That's really the key here right now is who wins on the economic argument of it. So you have a lot of people discussing whether or not it is actually going to save the system, overall dollars, or if it's going to actually increase the burden on taxpayers. I actually also got a chance to sit down with CMS Administrator Seema Verma to talk exactly about this. So listen to what she had to say.
I've had a lot of concerns about public option because I think it's essentially unfair competition. You are letting the government compete in the same place in the market that they regulate. That just does not seem to be fair competition. Medicare Advantage works because private health plans are competing against each other. They're not competing directly with the government. So the public option, I think, is really just a pathway to a Medicare for all. It would create a situation where it would give an unfair advantage to the government. The government traditionally is able to offer lower rates in Medicaid and Medicare because they pay providers less, substantially less. And so if you would have some type of a public option, I think the impact would be the providers would then increase their rates in the private market. So those of us that are getting health insurance through their employers, they may actually see their premiums go up.
So as you can see, as you heard just now, she's talking about the competition, about where the government's role is in all that. Where does the money come from? Who ends up taking on the burden? So, it just remains to be seen who can make the best argument and what the voters will actually pick up on.
Yeah, and where they'll want to actually put their money to work when it comes to Medicare for all.
Yeah, for sure. Did she show any awareness, though, of the cost of prescription drugs and the fact that people can't afford their insurance? I understand that she's talking about the companies, but what about the people?
Well, we did talk about also just drug costs and negotiations and pricing and price transparency, right? I think that's the first step that the administration is trying to take to even open up this conversation. And a lot of experts have been telling me, it starts the conversation, but someone has to take a forceful step, whether it's the market self-regulating or the government stepping in. And we saw what happened with those pricing bills. They went nowhere. So we'll wait to see.
Always a little bit less complicated to start the conversation than it is to finish it. But Anjalee Khemlani, thank you so much for bringing us that. Appreciate it.